hospital. Now, it's a very, very good thing to develop services in the community and try and prevent people coming into hospital. That is a good thing. But unfortunately, it hasn't worked out this way. We haven't been able to reduce beds. Admissions to hospital for older people here in the green line have gone up about 70% in 10 years in England and Wales. So despite lots of investment in the community, older patients still need to come into hospital, and we shouldn't be surprised about that. There are lots of them, they've got lots of diseases, they take ill lots of times. And it's being realised now, as I've just said really in the last slide, that hospital services must now just get used to the fact that older patients are going to come in, and they must get better at managing them. So this idea in the UK that increasing care in the community will lead to a reduction in hospital beds is fundamentally a flawed idea. It doesn't work. And what really needs to happen is this. And this is the slide that all healthcare managers hate, or health economists hate, because it's the more slide. Yeah, nobody likes the word more. Yes, we need lots of investment in community services for older people, but we also need investment in hospital services for older people. We need investment in all sectors in the health service for older people, or you'll end up with some of the problems that we're seeing in the United Kingdom. My final challenge for planners of older people's care would be this, and it relates to what I'm calling long-term care. So that's care for people who are chronically dependent, maybe with advanced dementia. And the challenge is, again, to balance care between domiciliary care, so that's care in your own home, and care in an institution, like a care home. And I'm really going to show you almost exactly the same pattern as I showed in the last few slides. The assumption in the United Kingdom over recent years has been that if you plough lots of money into caring for people in their own houses, and don't get me wrong, I don't think that's wrong, I think it's very good to do that. But the assumption has been that that will lead to a reduction in the number of places that you need in care homes. Now, I could illustrate the fact that this is wrong in a number of ways. I could show you some figures, but I thought the more kind of interesting or provocative way to illustrate the reason that this is wrong was to come back to death. The idea I gave you about everybody dying. Where do frail older people die? Well, in 2008 in Scotland, here's 3 age groups of patients, okay? And what I want to point out to you was that the older you got, 11% in this age group, 18%, 33% of those over 85 died in care homes. The older you got, the less likely it was that you could die in your house, your domicile. Now, some people use that as an argument for saying, well, we need more care in people's homes, right? They're saying that older people can't die at home. This is unfair. We need to put more resource into that. But in fact, I would use this as an argument the other way around. I would use it as an argument for more care homes. And the reason I would do that relates to this. Again, quite complicated looking slide, but I'll explain it to you. And it's the idea about illness trajectory. There's 3 lines here. The black line is the pattern of how somebody might die if they have a disease like cancer. The red line is something like heart failure. The blue line is frailty, dementia, physical frailty and dementia. Up this line is a measure of how independent you are, your function. And along this line is time. So typically, a patient with a cancer remains relatively independent for a good while and then has a relatively short decline to death. Okay? Now, it's feasible in those circumstances to soup up support in their house, get them back to their house and look after them there and allow them to die. A patient with heart failure has this kind of trajectory. They're less independent for a long time, and they have these dips when they're very unwell. But again, a relatively sudden acute illness often. But contrast those two with this line, which is the typical trajectory of somebody with dementia or advanced frailty. They're very, very dependent and slowly worse for a very long time. Months, years now in the United Kingdom. People can be as frail as that for so long. And I challenge any system in the world to care for large numbers of patients like that in their houses. It is not possible to do it. And I'd use that in itself then, the dealing with the changing pattern of death, as a reason for arguing that we need more care homes. This business that the frail old dies slowly with a long period of dependency before death. So our assumption in the United Kingdom that more care in the home leads to fewer care home places, again, is wrong. And it's the same idea. That if you're going to develop quality services for older people in India, yes, invest in care in people's houses, but we also have to invest in institutional care and care home places. Or you'll see some of the problems that we see in the United Kingdom with poor patients who shouldn't be dying in hospitals, dying there. The final part of my talk, which is quite brief now, is a challenge to us all, and that's about attitudes to ageing. All over the media, you'll find examples of negative attitudes to ageing. This happens to be from the medical media, and it's maybe somebody who should know better, the president of Canadian Institute of Health Research. But here he describes Alzheimer's disease as the grey tsunami. Now, I don't know about you, but a tsunami is not a very positive vision for me. It's a catastrophe, yeah? It's a horrible image. And I just use it as one example of the way that we can portray disease in older age. It's all too often negative. Our staff in hospitals are members of the society that they work in, and they often pick up on the views or have the views of that society. And here's a little study from the United States when they spoke to 3 groups of healthcare professionals and just listened to the language that they used to describe older people. And if you scored around about 100, you were regarded as being neutral in your attitude to older people. If you were less than that, you were negative. And the doctors, the radiographers and the nurses all betrayed in their language negative ideas about older people. And here are some of the terms that we'll often, day to day, hear about older people in our hospital. That they're bed blockers, crumble, what a horrible, horrible term. Delayed discharges or social admissions. And all they happen to be is older people who are ill. Yeah? But these are the kind of labels that are stuck on them. The tip of the iceberg in staff attitudes or carer attitudes to the old is, of course, elder abuse. And I was slightly shocked, I must admit, to find that there's an international journal on elder abuse and neglect. Yeah, so there's enough of it about for somebody to reckon that you can publish a journal every month with a whole lot of information about it. Isn't that in itself stunning? So it's a globally recognized problem, the problem of elder abuse. And here's one study from here in Chennai, 14% of in a study of about 400 people who were judged to be mistreated in some way in their care. Now, I don't have the answer to how you tackle those kind of attitudes, but the 2 main ways that people have tried to address it around the world are these. Advocacy or awareness campaigns. This chap's wearing a sticker saying best before age 65. Nobody has a shelf life. Yeah? So that kind of idea to people that there's no magic number at which you should start to be treated differently. So advocacy campaigns and public awareness. And the second thread is through legislation. And I don't actually know what legislation you may or may not have here in India to help you deal with this problem. How is the UK faring, with our population having aged from the point of view of attitudes? Well, there's nothing here I can tell you that I'm proud about. These are both headlines from the last year on the BBC, when both individual staff members, within the NHS are accused of failing to treat the elderly with care and respect. This is a very big issue at the moment in the UK. But also the whole NHS system is accused of being ageist, not giving enough resources to services for older people. And in many ways, although it's distressing to read these headlines, it's a good thing that they're there, because it means people are getting interested in it more and more. And when people get interested, that feeds through to politicians and things may start to change. So can India do better than the UK in terms of attitudes? Well, there are quite a lot of public awareness campaigns in India. This is one particularly good one that I liked, that I saw on the internet, Taught India, Led India, Fed India, trying to, again, make people aware of the fact that you shouldn't be treated differently because you're old. And this statement here, it maybe sounds a little bit grandiose. Be free, the aim is to be free of age-related prejudices, negative attitudes, age discrimination at individual, corporate and institutional level. But I put it there because, of course, one of our institutions is our government. Yeah? And our government must be free of age-related prejudices, negative attitudes and age discrimination. And I don't think there's a politician in the land that would stand up and say that they did discriminate against older people. But I'm sure if we all examine policies, you could find examples of where they probably are. More than that, I think if India's plan is to get ahead of the demography, its politicians will have to be proactive, yeah, almost positively discriminate in favour of older people. Because that 40 to 50 year period of change that I've showed you earlier on is going to go by quite quick, and the work needs to start now. I do appreciate, in saying what I've said there, that India has many healthcare priorities, and I've listed some of them around here. Control of communicable disease, population stabilisation. There's a number of things that people might argue are more important than care of older people. But I think care of the elderly is a very, very high priority, and I'll close by giving you two reasons why it's a high priority. Firstly, it's a high priority because if you don't have services that I've tried to describe for you that care for older people properly, it will impact, it will affect other parts of your healthcare system, as we are seeing in the UK with our difficulties in our hospitals. Many of which, are, as I've said, are of our own making, I would say. So that's the first reason. But the second and much, much more important reason, I would argue, is the effect on individual people. Yeah? The impact of having poorly developed healthcare policies for the old on frail, vulnerable people will be severe and extreme, and on a much, much greater scale than we see here, than we see in the United Kingdom. So I'd close with that quote. A nation's greatness is measured by how it treats its weakest members. I've got absolutely no doubt at all from my experience that the frail old in any society are amongst its weakest members. And from my multiple visits to India, I've no doubt at all either that India is a nation that aspires to greatness. So I'd finish by saying that I hope these words ring loud in the ears of your policymakers in the few years to come. Thank you very much for your attention.
Thank you, sir. We call on Dr. E.S. Krishnamurthy to conduct the question-answer session and give the concluding remarks.
People would like to ask questions. We'll take 2 or 3 quick questions before we close. Professor Chokkalingam.
I am Dr. Chokkalingam. I am a cardiologist, and happy to say Elder has given the excellent talk. I really appreciate the way it's structured. And recently I addressed 18,000 cardiologists in Munich in preventive cardiology. In the auditorium of 18,000, I came to know 30% of cardiologists already underwent bypass surgery and stents. I was quite surprised, elders. About 2 months back, I addressed 12,000 people in China, Beijing. I had opportunity. When my topic was how to live for 100 years. About 10% of the audience objected, I don't want to hear your talk. I was quite surprised. I asked them why. We are already 103, 108, 106. Why I am saying this statement is, I am very confident elder will address year after 100 not out. The reason is, I will give you only one or two tips. I don't want to take. Krishnamurti was my student. Excels his teacher and gives me happiness. That is what Krishnamurti is giving to Chokaling. He is doing it many fold much better than what Chokaling is doing. And happy to say that I had the opportunity of seeing M.E. Arunachalam, and Vellayan was a very young person at that time. 35 years ago, when he was admitted in the first attack, and R.S. Ajagopalan was stating, I had the opportunity to see him, and he was replica of his father. I was really, as though he has been cloned and like that has been done. Nothing, I don't want to waste your time except just sharing one or two points. Now I am conducting international conference in Radisson Mahabalipuram, and I want to give only one tip for my audience. If you want to be away from Chokalingam, please be very clear, be positive in approach, be calm all the time, be happy. You carry happiness wherever you want, never compromise happiness. 1. 2, if you want to live for 100 years, please strictly follow 3 mantras from today. 1, be positive in thinking, be healthy in eating, be adequate in exercising. We don't have any need of any doctors. You must educate from the age of 15 all our students. Actually, I am the head of the department of cardiology even today. The 8 floors, I never used even lift once. I am climb up all the 8 floors by steps only. And one day one liftman told me, why don't you come up by lift? I told him, வேண்டாப்பா ஏன் தொந்தரவு பண்ணுறேன் லிஃப்டில் வாங்க சார் மேலே சீக்கிரம் போயிடலாம். To avoid it, you can go make that quick walking is the habit. And in conclude, please understand life is a match, which I admire Vellayan, how he has been so active, how he is smiling. The smile alone is going to keep you all away from us. And and life is a match. Please underline that. Add good things, deduct bad things, multiply your knowledge, divide your time, live all the time in balanced way, so you all will live more than 100 years. Thank you very much.
I said at the beginning that I wouldn't give any tips on how to live to be very old. But I can give you 2 tips. One's that's semi-evidence-based. The first, though, is my first tip on how to live to be 100 would be live to 99. Right? Because if you get to live to be 99, you've got a fair chance of being 100. But the second and sort of evidence-based one is we see lots and lots of people now who are 100 or more. It used to be extraordinary in the wards, but now it's commonplace. But I've been in the habit of asking them all, one what I would call open question, and several what we would call closed questions. And the closed questions are, do you or did you smoke cigarettes? And most people over 100 will say no. Do you or did you drink alcohol? And most will say, in Scotland, yes. In fact, I met one man who was 100 who said, well, I used to drink alcohol. And I said, when did you give up? He said, 2 months ago. He said, when I got to 100, I thought I'd had enough. I then asked them, were you fussy eaters, picky about your food? Were there things you would not eat? And most people say no. They would have eaten anything that came along, basically, maybe reflecting their socioeconomic status. And the fourth thing I asked them is, do you come from a family of long livers? And most say yes to that. So I know that that's totally unscientific. But the open question I ask them all is, what's the secret of living to 100 years old? And anybody like to tell me what the commonest answer is? The secret of a long life.
Happiness.
Happiness suggested here. Well, in fact, the commonest answer in approximately 1 people aged over 100 that I've asked that question is hard work. Now, it's either true or they're a very self-righteous group of individuals.
I think I'll take 2 questions.
Dr. Elders, I must congratulate you on
Thank you.
The excellent oration, which has really, brought into focus the challenges that India is going to face with regard to managing the elderly. As a geriatrician who's been practicing for the last, one of the very few geriatricians in the country, I must say, who's been practicing for the last 12 years, I fully endorse and agree with what you're saying. You had mentioned about, you'd given statistics about people dying, hospitals, homes, and care, domiciliary and care homes.
Mm-hmm.
Now, in India, there are hardly any care homes at all. And I don't see care homes coming up in a big way, simply because care homes will require a lot of resources. And I don't see anybody investing in care homes. So that is a challenge that India is going to face, and how are we going to deal with the frail elderly? And that is something, traditionally it's been the family, but I don't know how it's going to go from here. It's something for all of us to think about. Thank you.
Well, there's lots of information I could have shown you tonight. I've shown you quite a lot of information about what the UK is like, but The Economist magazine that you may be familiar with did an international survey of terminal care. Yeah, of the quality of terminal care around the world. And I'm sorry to say India was bottom of that table. It's well up in many other parameters of healthcare, but there it is, somehow right at the bottom of the provision of high quality terminal care. So I think provision of that kind of care brings you back a little bit to the public-private split, and how could you get the private sector interested in that kind of care. I think at the moment as well there's also an expectation issue, I guess, that many people perhaps more in rural communities would not expect anything other than dying at home. But as I suggested at the beginning, old people in the future will be very, very different and not as accepting of this. And I think if care homes don't spring up, your hospital services are going to see a lot of older people dying there, I'm afraid.
One last question, and I think we should leave it to a senior citizen.
I just wanted to know, with stress on more care of the elderly, 80 plus and all that, is there not, the people must be educated to grow old gracefully and put off dependency. Is it not possible to do that by starting this program very much earlier, even at the age of 50 and all that, to prepare for old age? I don't say old age, advanced age, let us say. I don't like to call it old. So advanced age, to grow gracefully and prepare for it and put off dependence up to at least say 90 years or 95 years, if not 100 as he said. Is it not possible to train them from early on, make them aware this maybe more work to the brain, for example, to avoid dementia and the infirmity of the brain and so on?
Well, I showed you Mr. Singh, the marathon runner, at the beginning. Nobody knows his secret. Why has he been able to keep spry and healthy and fit through to that age? But I guess I'd say a couple of things. It depends what you mean by grow old gracefully. If you mean and gracefully accepting that is given to you, then I wouldn't agree with that. I think older people should be very, very strongly standing up for what they think they need. But the more, I guess, practical side of that is that there is quite a lot of recent interest in exercise in middle age. Yeah, we've got a culture in the UK, and you probably have here too, of exercise amongst the young. Yeah, now whether or not they carry that through their lives, I don't know, and what impact it will have, I don't know. But certainly there's emerging evidence that even if you start exercise at the age of 50, 55, 60, that has very positive effects on, for example, balance, muscle strength and balance. So yeah, you probably can grow old gracefully, but I wouldn't profess to have the secrets.
I think a big hand is due for a wonderful lecture. Thank you, Professor Elder. Perhaps I should. As someone who works here with older people, I thought I should just make one or two little observations. One is, of course, that nuclear families are taking over, where extended for that one reason alone. We also have an interesting phenomenon in India, which I keep talking about, called PICA, or Parents in India, Children Abroad syndrome. So you have elders here, the children are abroad, they're not here to take care, they are willing to spend all the money in the world, but who's going to do the caregiving? And I think we have that challenge in India to meet as well. And of course, we have another issue, which is, I think most Indians perhaps are not mentally prepared to go and live in a care home. Most people want to live at home, and most people would like to have their loved ones close by, if not exactly under the same roof. And therefore, that is one of the other challenges of aging. We have to prepare a population to believe that it's all right to be cared for by professional caregivers. We have other challenges also in that I don't think many young people want to get into the caregiving profession. We don't have too many takers for health care itself, and I don't think we have too many takers for elder care. People want to work in IT parks, people want to work in malls, people want to be in retail shops, but they don't want to look after older people. So how are we going to make it attractive for younger people to be willing to caregive is going to be another attitudinal challenge. And I think it's the moolah, but it's very difficult to make the money available, unfortunately, in healthcare. In VHS, we have 55 elders on campus who stay there by virtue of their medical disability, and they like to have access to the hospital. And then we have a center where we look after about 12 people who are medically ill. And I couldn't agree more that there is a need for both acute care and rehabilitation care and chronic care all rolled into one, because that's a true geriatric service. You can't really do just one or the other. So I think it's a really important point. 3 tips, since we are on, how do you age healthily. For dementia, they say this: walk to sweat for 45 minutes every day. Eat plenty of fruit, especially pomegranates, and keep your mind active. And I believe that crosswords and puzzles and Sudoku really helps, especially after you've stopped working, because then you're not using your mind so actively anymore. So I would encourage everyone, not just the elderly, to keep doing all these things. And I think with those few tips, it's time to say thank you. First to the speaker, Professor Andrew Elder, for being here with us. Professor College and all her colleagues from the Royal College of Physicians of Edinburgh. It's an honor to have all of you here. The family of Sri M.V. Arunachalam for their support to VHS and to a number of other causes. I think our team for being so supportive and part of all this. To the delegates who've come from many parts of India to take part in these 2-day deliberations. And I think very much, last and certainly not least, to all of you for being here today, for making this 10th lecture in the series a great success. I think the packed hall tells you that. Thank you so much.
We request all of you to rise for the national anthem.
Jai Jai Mangal Gayaka Jai Jai